these individuals who were classified as PTSD after one experience with MDMA and with continued psychotherapy. 81% of these individuals in their trial no longer were classified as individuals with PTSD. They no longer met the definition of PTSD. So
Amazing.
that's how powerful MDMA is.
If you like our show and want to learn more, please visit our website at peakwellnesshealth.com, which is linked in the show notes below, where you can gain access to a very simple 10-day body reset program that teaches you about diet, sleep, meditation, exercise, and guides you on how to lower blood sugar, lower blood pressure, lower body fat, and improve your biomarkers all in just 10 days. Additionally, you can find a body optimization program, which teaches you how to lose fat and build muscle. You can also find a link to schedule a one-on-one consultation with me. Welcome back to part 2 of our 2-part episode on the health benefits of hallucinogens and plant medicines with Dr. Diva Nagula. If you haven't had the chance to listen to part 1 yet, make sure to tune into that one first so you won't miss any of this invaluable information. Okay, let's jump in. Can you give us some case studies, some examples of patients that you've seen that have come to you for hallucinogen therapy, and the way they were before, the way they were after? What kind of results have you seen?
Okay, so before we do that, happy to give you some case studies, some personal case studies. Let's talk about some studies that are ongoing now.
Yes.
In relation to some psychedelics. And I want to give you a little bit of a landscape as to where we are on a federal level of legalization.
Yes.
So MDMA is, I guess, as I mentioned before, is the active ingredient in Molly and ecstasy. It has been experimented with by a nonprofit organization called MAPS, and it's the Multidisciplinary Association for Psychedelic Studies. So the person who runs this organization, Rick Doblin, he has been doing this for 40 years. He's seen the initial revolution of psychedelics back in the 60s and how it had almost gotten to a point of legalization. And there were studies and there were people that were working with psychedelics from a psychiatric perspective, but because of some instances by some individuals, if you're into psychedelics, the world, Timothy Leary was an individual who really pushed LSD onto a lot of different people. And unfortunately, because of the widespread of this particular medicine, which was illegal, got attention where President Nixon at the time decided to really put a war on drugs, and he made everything illegal, and he classified all of those hallucinogens, including MDMA, as a class 1 substance. And so this perpetuated into the next presidency with Ronald Reagan, where there was this whole war on drugs. And so unfortunately, we were on the precipice of huge gains in the mental health realm with these substances. And 30 years ago, Rick Doblin has been a big proponent of psychedelics. And he really had an interest in developing MDMA and is as a medicine for therapeutic use. And what they found through many studies over many decades is that MDMA has an indication specifically for PTSD. And in fact, we're looking. That's what the FDA. That's what it's been applied for to the FDA for a approval for the indication of PTSD. They've taken plenty of people. We're talking people who have severe PTSD. We're talking war veterans, abuse victims. And when they're on their protocol that MAPS has people use for MDMA therapy, it typically involves, I think, 2 or 3 experiences with MDMA with 2 facilitators over a 6-month period with integration and psychotherapy after each experience and ongoing. They noticed that these individuals who were classified as PTSD after one experience with MDMA and with continued psychotherapy, 81% of these individuals in their trial no longer were classified as individuals with PTSD. They no longer met the definition of PTSD.
Amazing.
So that's how powerful MDMA is. And there's a push for now that MDMA is you'll hear about it all over. This is one of the medicines that's utilized in PTSD, but they're going to have some sort of ruling in the next year, maybe year and a half, where it will be legalized. We just don't know in what fashion. If people have to be trained as a MAP certified therapist to be able to prescribe MDMA, we don't know the details as to how it's going to be legalized, who's going to be able to prescribe it. So that's in the works right now, but that's very close to being legalized.
I mean, to put this in context, the traditional model of therapy has like a success rate of, I would imagine, like what, less than 10%?
I mean, if you're talking about with just through psychotherapy, I would say maybe a little bit more than that. But if you're talking just regular pharmacology, as we know, it's in any kind of mental health disorder, it's typically a 30 to 50% success rate. But that doesn't take into account the quality of life that these individuals are experiencing post pharmaceutical intervention. I often see these kind of clients all the time who are on SSRIs. Their emotions are blunted. They can't feel the highs. They don't feel the lows. They just don't feel. And, their quality of life from an acute perspective, I think this is fine. But when you're talking about people who were on this medicine for 6, 10, 15, 20 years, yeah, that's not what it was intended for. It was intended for acute issues of severe depression or PTSD or trauma. Yeah, I agree with that. But the prolonged use, that's not what it's intended for, and never was. And that's where we're seeing the longer the clients are on it, they're going to have developed what's called treatment-resistant depression. That's a whole different topic, but that's what ketamine is used for. Its indication is for treatment-resistant depression, and meaning that people who have depression, who are on multiple pharmaceuticals to control the depression, are still having depressive type symptoms. And that's typically because of the number of years that they're on it. They just revert back to their acute mental issues that they were suffering initially, where these antidepressants were probably helping in the very beginning. So yeah, so it's a sidestep in terms of ketamine, but MDMA is what we're talking about initially. It will be legalized shortly. Ketamine, and just to clarify, ketamine is legal. It is utilized in current situations in the medical world as an anesthetic. It helps induce anesthesia for patients who are undergoing surgery, outpatient or general. And this is a medicine that's been used for many, many decades in that field. It initially was used as a horse tranquilizer or a horse sedative when it was first produced. But what they found about ketamine is that in small amounts, it can be used as a psychedelic agent. And it really is so awesome for people who have treatment-resistant depression, because people can feel so much better and improve and livelier. I typically use ketamine on individuals, as we mentioned before. They can't take psychedelics if they're on an SSRI or other antidepressants. So what do? Do we just wean them off? What's going to happen to these people when they're weaning off of their SSRIs or other antidepressants? They get a rebound, and that's the problem that is happening when you have these facilitators or other people who don't know what they're doing. When they facilitate, they'll say, "Oh, you need to be off your medicines," or they won't know what medicines the person needs to be off. So that's a whole different problem. But these things that's why I'm a big proponent of having a health professional be in a team of individuals that are helping facilitate these experiences. It's a very sexy thing to get involved in as a client or as a facilitator, but they have deep repercussions if you don't know what you're doing when you're talking about weaning off antidepressants or interactions of psychedelics with antidepressants. So I'm always a proponent of having a health care practitioner, whether it's a MD or a PA, a nurse practitioner, or someone that knows what they're doing. It's really important to have that person as part of the team of facilitation. You need that.
Okay, so you spoke about MDMA, ketamine. What about research surrounding psilocybin?
So psilocybin is probably the next medicine that will be legalized, if not shortly after MDMA. Before, we're actually already seeing legalization of this. Like I mentioned before, Colorado has legalized this, and so is Oregon. So It may even be on a federal level, be legalized before MDMA. We just don't know. There are many studies that are showing benefits of of the use of psilocybin when it comes to anxiety, depression, OCD, addiction type of disorders. But many of the studies that are currently in play have to do with mental illnesses, specifically anxiety and depression. They've also shown that individuals there was a study out in Hopkins that showed it was 4 people who had cancer, stage 4 cancer, and they were all given psilocybin while these people were in hospice. And every single one of these individuals had a profound experience where the patients no longer had this like morbid way of their lives. They didn't have this mindset of impending doom. It was very much, it reset their mind where they were able to live their last days in happy, and they were able to see that everything was taken care of for their families, and they just had this reset of their brain that allowed them to function better and enjoy whatever time they had left.
Yeah, that's so amazing. I mean, the way I visualize this is, and there's some anthropologic data suggesting that we have evolved concomitantly with these plant medicines. I mean, as humans have evolved, we have taken these to help us in various ways, and only recently have these substances been frowned upon because of legal issues, as you described. But now we're getting back to it, and we're seeing how these are so beneficial. I mean, it just blows me away hearing about how people recreate these new neural connections in just one session.
Yeah, and that was kind of like the next thing I wanted to talk about. They did functional MRIs of individuals who were on, I can't remember if it was psilocybin or another hallucinogen, but they were able to see on the functional MRI that all the aspects of the brain were talking to one another. And you could see the activity in one lobe of the brain talking to another lobe of the brain. It's just these neural pathways and don't typically present itself, and creating neural pathways is a hallmark of hallucinogenic substances like psilocybin and like LSD. And the benefit of these neural pathways is that it improves the connection of the brain, and it allows improved cognition, improved memory, and it also improves health disorders like depression and anxiety. But what they're also seeing in the functional MRI, that there's a specific area of the brain, and I can't recall where the location is, but the general term is called the default mode network. And I mentioned this earlier. This part of the brain, there's no activity. And it's that part of the brain that's reset when we're taking psychedelics. And it's an area of the brain where we all have hyperactive in one time in our lifetime or constantly, where it's that self-critic. I mean, that's our ego,
Right.
always playing those games of being that self-critic, and where this constant self-deprecation is constantly playing in our minds, and rumination is a huge part of that default mode network. And so it's these substances that have such a profound effect in resetting that area, that it's equivalent to having a hard drive where it's severely fragmented and you defrag it, or just turn the power button off and turn it back on. You're able to get full functionality. It's kind of the equivalent when we're talking about what it's doing for the brain.
Are you struggling with reaching your health goals? Do you feel like you need extra help to achieve your desired level of wellness? Well, we're here to tell you that you're not alone. Our website at peakwellnesshealth.com, which is linked in the show notes below, offers a variety of resources to help you on your journey towards optimal health. One of the most popular resources is the 10-day body reset course, which is designed to teach you about diet, sleep, meditation, exercise, and how to lower your blood sugar, blood pressure, body fat, and improve your biomarkers all in just 10 days. Our program is comprehensive yet easy to follow, and we've seen amazing results for those who have completed it. But that's not all. We offer a body optimization course, which teaches you how to lose fat and build muscle. Our program is tailored towards your individual needs and goals so that you can be sure that you're getting the most effective guidance. And if you need even more personalized support, we offer one-on-one consultations. During these sessions, we'll work with you to create a personalized plan that takes into account your unique circumstances, preferences, and goals. Visit peakwellnesshealth.com today and take the first step towards achieving your health goals. Diva, we've all known people that do a lot of these substances. Like I'm just thinking of a particular friend who was one of these guys who was on or a Deadhead, right? Followed the Grateful Dead. He would do LSD often. And he's the type of person that you could look at him, you're like, yeah, this guy does drugs. It's like, there's something about him and he vibrates that. And you mentioned before that there's no long-term side effects. I'm wondering, is this just personality? And it's not, certain people have certain personalities and these drugs maybe just exacerbate more of that versus something else going on that is caused by the drugs?
I think that's more of a stereotype than a generalization. So I don't know if that's across the board. Yeah, I was exposed to these type of individuals when I went to college too, and I was like, these people are just druggies or potheads or whatever you want to call it. I think that was just our stigma that was branded to these individuals because of what the media was doing when they were on this war on drugs, and it's just that's all that they kept pounding to the public, whether it was print media, magazines, TV, newspaper, whatever it was. It was harsh. Some of these people whom I were in college that I know of that were on LSD or took LSD, they're one of the smartest people that I know right now. Their brains are highly and functioning intact. They all have really good jobs. And I'm not talking about people that are on marijuana. I'm talking about people who have done LSD or mushrooms back in college. There are individuals who are highly functioning. And I'm like, was it because of the utility of these psychedelics, or were they always brilliant minds? It's a yes and. I mean, I think so. Yeah, and they were probably smart, and this just enhanced their brain activity even more so.
Yeah, yeah, I can see that because I can think of examples of people like that that are also quite successful and quite intelligent. So that makes sense. I mean, obviously a lot of this is stereotypes, but it does give you pause when you think about sort of the repetitive nature of doing these. Like if somebody really loves the effects and does it over and over and over and over, are you saying that the data currently shows there are no consequences to that?
Well, there hasn't been any studies that have accounted for numbers of experiences, and I from my personal experience and for other people who have done a lot of psychedelics, they're not side effects in terms of the brain is malfunctioning. What happens is that through the psychedelic utilization, we have what happens is our consciousness expands. And as our consciousness expands, the individual becomes more open to stimuli and they're more sensitive. And so that's because if you read, I don't know if the author Aldous Huxley, Doors of Perception, he wrote a book where he talked about this reducing valve, where we as individuals have this reducing valve and each one is different. And that what a reducing valve does is it reduces the amount of information that we perceive. We're exposed to 4 billion bytes of information per second, and we only filter out what we can actually take in, and that is the equivalent of 2,000 bits per second. And so, as we open up our consciousness and raise our consciousness, and our awareness is increased, and we're more expansive, that reducing valve is open more. And so it allows more information to come through. And so if we're not ready for this information to come through, it can be a lot for a person to take on. It can cause issues of, I would say, not hyper anxiousness, but they're more hyper excitable. If they're not ready for it, they're more, and this is more, there's no research behind this. This is very anecdotal through what I've experienced personally and through other people have experienced. There are more sensitivities to other types of frequencies that come through, specifically frequencies that aren't resonant. And as we become more open and our consciousness expands, we have more of a resonance with the Schumann resonance, which is the frequency of the earth. And that frequency, we lose that frequency and that resonance because of all the technology and because of all the other frequencies we're getting hit by. If you research back in the day before this industrial revolution, people were living comfortably living with not a whole lot of health issues. A lot of it had to do with the fact that we weren't being bombarded by all these frequencies, and we were resonant with the earth frequency. The earth is there as a grounding mechanism. That's why the earth, it's important for people. If you ever see people that are having issues with their mental health or they're anxious, one of the very non-pharmaceutical simple things to do is go out there and put your bare foot on the ground and just sit on the ground, because it's grounding. And in the grounding, there's an electron transfer that's occurring where the earth is taking all of the frequencies and the energies of the body that isn't serving the body its best interest. And people feel better after that. It's a science behind that. And it's a resonance that we lost because we are sitting here on our Wi-Fi's or on our tablets and being bombarded by 5G. So as point being is that as we're more open, we need more resonant frequencies like the Schumann's resonance, the Earth's resonance, to ground us and to help us. And that's one of the reasons why I want to go to Costa Rica, because I want to be back in nature. I crave being in nature. I have this tendency where if I'm around a lot of people or too much noise or too many artificial technologies, it hurts my system from a sensitivity point of view. Is that everyone? I don't think so. I don't think a lot of people aren't. It does increase sensitivities. I'm more empathic as a result of this. I can pick up on people's feelings and nature and a lot more easier. And that's what makes me a good facilitator or a good practitioner. But it can come with a price. And if you're not ready, and the point is if you're not ready for it can really cause issues. If you're taking your time and exploring these types of medicines and these psychedelic therapies and integrating, that's the key, is integrating. It's not the way it's not designed for you to do one experience after the other just to experience the high. That's not a therapeutic benefit. That is addiction. That's like taking drugs or alcohol or tobacco or pharmaceuticals. It's not solving the problem. That's why I mentioned earlier that 75 to 80% of the experience is the integration. And if you fail to integrate, then before going on to a new experience, you're just backing up your system.
Right. Yeah. I mean, that's true. Too much of a good thing is bad, right? Even like I recall reading about this case where this woman heard that kale was good for you, and she ended up eating like bags and bags of kale, raw kale on a daily basis. And then it had a consequence, like it caused like severe hypothyroidism or something. There's something in the data that supports like a tremendous amount of certain types of kale will cause complications. But anyway, my point being that too much of any good thing for you is bad. And as you mentioned, when it becomes an addiction, that's a problem. But when you're using it as a therapeutic tool, when you're using it to ground yourself, to vibrate with the nature surrounding you, it's so powerful. And I love how you describe that and put that, because I feel the exact same way. I feel that we've lost our connection to nature. I think it's so important just to get outside. And very often you hear people that have done these substances like psilocybin say, you need to go out in a park, you need to go in nature and experience it there, because that's where you're going to get the most benefit.
That I failed to mention that it's not ideal to do it in someone's apartment in New York City or in Washington, D.C. It's not. The whole experience expands your consciousness, and what you're actually tapping into is the frequencies that are around you in the city. And that's not appropriate. That's what you want to get away from. So ideally, yes, if you're to do this experience optimally, it's to do it in nature. That's how it's been intended for. And psilocybin has been around for generations, and talking about millennia. It's been around for a long, long, long time. They're even talking about how mushrooms have contributed to the evolution of man. And so it's fascinating if you trace it back that far.
Yeah, absolutely. Okay, so this was all fascinating discussions, and I really like how you described how there's more and more data supporting these types of substances and how they will soon become federally decriminalized and legal. So we're all waiting for that to happen. Let's get to the case studies. Just describe to us some case studies.
Yeah. So personally, for what I've witnessed through facilitation, I mean, I've had a lot of people that have come through with various issues that they want to have helped. I can remember one individual who had come to me because he had an alcohol abuse, and he was using it because it was masking emotions that he was just stuffing down. And he ended up having pancreatitis and having to go to the hospital and having to go through that whole process of treatment. And then when he came out, he was just severely in a bad state of mind because he all of a sudden the emotions that he was stuffing down with alcohol were surfacing, and then he never dealt with the process that. So someone reached out to me on his behalf, and we ended up getting connected. And he came to me, and we did an experience together. And he was immediately impacted in a positive way. He was kind of very much of a flat affect, depressed when I saw him, and then as the medicines were working on him the next day, he's a different person. He was open. He was in his heart center. He was grateful, and he never wanted to. Then he had an intention. He wanted to face his demons, and which were his parents. And he was that was his that was some of the insights that he received in his experience, is that he really needed to face his parents, something that he never wanted to do. And they gave him the courage to allow him to face his parents and have a discussion with them, and there was some resolution to that. And so that was a really a good story of an individual who had an addiction, which goes to show you that this medicine does help with an addiction. I've had another individual
it really tackles the root cause of the problem. The root cause sounds like he had some traumatic experience with his parents, and then once he realized that and tackled that root cause, then the addiction just melted away.
Absolutely. I had another individual. She was on SSRIs for 20 plus years, and it stemmed from a instance in college where she found a peeping Tom in the attic, and that just really scared the crap out of her, to the point where she went into a state of depression and developed PTSD as a result. And so she always had, as a result of this instance, she just always had some issues with self-esteem, developed issues of just being alone, and also had a lot of anxiety and depression as a result of all this. Had therapy, did nothing, really took anything away. And then suddenly someone told her to experience a psychedelic session. She did, and she was on the SSRIs, but only was given the psilocybin. And like, as I mentioned before, when you're on the psilocybin or you're on the SSRI, you're not going to feel the SSRI. She might have felt a little bit, but nothing enough to reset the brain and to give her some insight. But what it did give her was the ability to have the courage to see that there was more, and more of a life beyond what she was living. And she ended up having weaned herself off the psychedelics, and it didn't actually work. She went into a rebound, and then that's when she came to me. She saw me, and I helped her wean her off the antidepressants. Yeah. And then the whole goal of that was so that she could fully go through a full psychedelic experience. And after she weaned, she had 2 sessions with me over a period of 6 months, and maybe even less than that, 3 months. And it was so impactful that she no longer suffered from the depression. She was able to process the initial trauma that she experienced 20 years prior. And this is something that she could not do with antidepressants and with therapy. But overnight, using psychedelics in an experience with me, she was able to process that trauma, go back in time, relive that experience, and reprocess it with a different frame of mind. So it closed the loop of that trauma, and it no longer affected her as it did for 20 years, to the point where she was able to, in months later, she got a new job. She got a new boyfriend. She actually met someone who became her partner, and who she's still with today. And I think she's either married or engaged to this individual. So, and she owes it all to, and I'm not trying to boast or anything, but she recently reached out to me and says, it's been 2.5 years since my experience, and I owe all the changes in my life as a result of the experience that I had with you. So it's yeah. I mean, and this is, like I said, a person who was in the Western medicine world as a patient for decades, 2 decades.
Yeah.
And we were able to work with her and see a huge shift in a short period of time.
Is there an age limit to this kind of therapy?
I honestly think it's individual based. I'm not going to give any medicine to a 10-year-old, but I have seen a 16-year-old, and that's the youngest I've seen. Oldest I've seen was probably 75, and that was recently. And yeah, she was an individual with anxiety. and her anxiety had gotten worse after going through this whole pandemic, and that's a whole different discussion. But it caused her to have a lot of anxiety, and she went through 2 sessions, and all I did was give her ketamine, and she's done extremely well as a result. And the medicine has helped her tremendously, and I think she may be at a point where she might want to experience another journey such as psilocybin, just to optimize the two experiences that she's had with me so far.
What about any cases where things went south, went sideways?
That doesn't happen to me with me.
That's
No,
amazing.
I haven't had any cases where it went sideways. I mean, I've been in groups and settings where a person had a reaction to it, but all expected. Like, so there was a reaction where somebody relived their or had an image or a visualization of a memory that was suppressed by their conscious mind of them being molested by their father. And that was traumatic, and the person suppressed all of that when that's what our minds do when we experience trauma. And
Right.
so these medicines, that's what they open up our mind, where we can have these repressed memories come through our conscious mind. And so again, if the person's by themselves or with someone that's unexperienced, as a facilitator, they're not going to be able to have resolution, and it's all it's going to do is re-traumatize them. So fortunately, the person was in a group setting with a good facilitator, and that person was able to get help to process the trauma.
What about couples therapy? Has that?
Yeah, I've done a lot of those too. It's beautiful. MDMA is a medicine, like as I mentioned before. It dumps a lot of chemicals, feel good chemicals, into our bloodstream. And so a lot of people I've seen come together or actually go to a different level in their relationship as a result of MDMA therapy. I find this, there's couple therapists that are often seeing clients for interaction, for improvement, or for assistance with their relationship. And it's amazing. One experience with MDMA almost inevitably fixes issues, or it helps resolve issues in an amicable way, so it can actually create a better separation. Like, I've seen people who, one person of the couple of the two would come in because they really wanted to make the relationship work, but in the end, they both came to the realization that the relationship wasn't in their best interest, and they were able to break away amicably. No lawyers, no attorneys. They were able to just go through the divorce process in a very cordial manner.
Wow.
So it goes both ways. It fixes relationships, or it allows people to uncouple in a nice way.
Well, Diva, this was such an interesting topic, and I'm so grateful to you for sharing all that you have. If somebody is interested in learning more about you, learning how to get involved in your clinic, how would they do so?
Yeah, they can go onto my website, divanagula.com. There's a lot of information on there about services that I provide. And if they want to engage in a consultation, there's ways that they can do that on the website.
Excellent. Thank you so much. It was amazing having you.
Thank you.
I hope you enjoyed this podcast. And if you did, please make sure to hit the subscribe and the like button and leave a comment about what you'd like to see on our future episodes. Just a reminder that this podcast is for educational purposes only. It does not substitute for professional care, nor does it constitute medical or other professional advice or services. If you're looking for medical care, please seek a qualified doctor or medical professional. For more information, or if you'd like to check out our programs, please visit our website, peakwellnesshealth.com. That's peakwellnesshealth.com.